for University Research Ethics Committee. CTU, through its Research Ethics Committee, is committed to the highest standards of research integrity, and ensures that all research stakeholders comply with the principles of research ethics, and promote the values of honesty, transparency, privacy and confidentiality, scholarly rigor, respect for the rights of human beings and justice. This video focuses on the following objectives. To discuss the first, but very essential requirement, that every researcher must comply before implementation. To know the historical background of institutionalizing the Review Ethics Committee of the University. To discuss the legal foundation of research ethics review. When CTU became a university by virtue of RA 9744, it aspires to be a research university. Along this view, the creation of a Research Ethics Committee becomes imperative. Thus, the BOR, through Resolution Number 61 Series of 2018, institutionalized the Research Ethics Review Committee. By virtue of this resolution, the university tasked the Research Ethics Review Committee to undertake the following. 1. Conduct information drive on research ethics review. 2. Act promptly on research proposals and study protocols. 3. Review post-approval submission. 4. Conduct site monitoring visits. And 5. Keep and secure all documents pertaining to its functions. With these tasks, the University Research Ethics Committee, or the UREC, oversees that all research undertakings should comply with the institutional, national and international standards of conducting research involving human participants. Protection of human participants, who were subjected to the research methodologies and rigor, was the primary role of UREC. As provided for by Section 5 of RA 10532, the health status, productivity and the quality of life of Filipinos are safeguarded and promoted by 1. Ensuring that health research is linked to the health system needs. 2. Ensuring that investments in health research yield the most benefit. 3. Promoting good governance among health research organizations through efficient, effective, transparent, and ethical health research management system. 4. Engaging in national and international partnerships and networks for health research development. And 5. Ensuring sustainability of resources for health research, as stipulated in Sec. 5 of RA 10532. Through this law, the numerous administrative orders and issuances of lead agencies of the national government were finally put in place. The provision on research ethics review was in Section 12 of RA 10532. The law adopted the DOST Special Order No. 91, Series of 2006, that created the Philippine Health Research Ethics Board, or FREB. The FREB is the overseeing body to ensure adherence to the universal principles for the protection of human participants in research. In 2007, the Department of Science and Technology issued Administrative Order No. 001 requiring that all research proposals submitted for funding through this government agency and all other government agencies undertaking research that involves human participants should undergo research ethics review prior implementation. Through this issuance, Research Ethics Review safeguards the safety of human participants in research. Higher education is not exempt from the requirement of RA 10532. The Commission on Higher Education Memorandum Order 34 Series of 2007 endorses DOST Administrative Order 1, Series of 2007. Toward this end, the two lead agencies issued Joint Order No. 1S 2012, requiring all higher education institutions to implement the provision of RA 10532, to include programs that requires thesis or dissertation as a requirement prior graduation. Safety of the human participants in research, by virtue of this joint memorandum, has been secured. Hence, all HEI are mandated to organize their Research Ethics Review Committee for the purpose of safeguarding the welfare of human participants involved in research. So, what is research, as viewed from the perspective of the Philippine Health Research Board, FREB, or from RA 10532? According to FREB, research is any social science, biomedical, or epidemiological activity, with the intent of getting identifiable human markers, using systematic data analysis and procedures, with the intent of generating new knowledge. From this definition, it is clear that researchers or scientists are not forbidden to get information from human participants for the generation of knowledge. Only there are some conditions that need to be observed and followed. So, what are these conditions or requirements? According to FREB, as prescribed in the National Ethical Guidelines for Health and Health-Related Research in 2017, the participation of human beings in research can only be justified if the study has a social value. FREB continued that a study or research has a social value if such results are expected to bring about a better understanding of related issues or contribute to the promotion of well-being of individuals, their families, and communities. It is expected then that all research undertakings should give solutions to human problems, promote the well-being of individuals, their families, and communities, or give a better understanding of different issues affecting our society. So, how is it done? In the research proposal, proponents should demonstrate clearly the significance of the study in a separate section of the proposal, with an accurate and updated description of the status of the social or health problem. It should answer questions like, what is the problem that this study has identified? In this connection, proponents should also describe the problem. Moreover, proponents should describe the intended beneficiaries of the research, as well as state how the study will help arrive at a solution. The study design, methodology, and data collection, in its overall, should be able to generate information and supportive of the objectives of the study. FREB emphasized that social value of a study can only be realized if the study has scientific validity. Moreover, the use of vulnerable participants should be clearly described in the protocol, the type of vulnerability, and the type of protection that will be afforded to them. Furthermore, research proponents or principal investigators should also provide justifications on why these types of participants are to be involved in research. Finally, and a very important component to be included in the research proposal, is a dissemination plan for the results of the study. This dissemination plan not contains the different activities, but should also demonstrate its doability. The type of dissemination activities can either be in the form of publications, conferences, meetings with the direct beneficiaries, or policy formulation. Furthermore, the Research Ethics Committee shall determine the appropriateness and the practicability of the dissemination plan, as well as the suitability of the recipients of information. Based on these requirements, research undertakings involving human participants are justified. Why? Because human equity or people contribution is essential in the generation of information for the solution or understanding of human or social problems. In this lecture, we have discussed the necessity of conducting research and the requirements to comply with in the use of human participants in research. All information shared in this lecture are contained in the national guidelines in the conduct of health-related research. In order not to waste our time and energy, researchers should clearly illustrate and explain the contribution of the proposed research in the improvement of human well-being. Finally, research results should be disseminated to the beneficiaries.